So patients sometimes ask us when to do the hair transplantation. Actually, sometimes patients are waiting for a while until they lose most of the hairs and they want to come like that, but we don't recommend it for the patients because they have to start something and they have to protect their existing hairs. So please don't wait until you lose your hairs because it's hard to recover at that part. So during the operation we just protect your existing hair if even they are thin, and we give some products after usage, after the treatment, like finasteride, minoxidil, and sometimes PRP treatment, so we can recover your existing hairs as well. And as a combination with the hair transplantation, that thinning will become thick and we transplant hairs, so as a combination we give a good result for the patients. Okay, so why direction of the hairs are so important? Because it gives us a result. So the main thing of the hair transplantation, of course, not creating a damage on your donor area, but creating a good natural look for every patient. What is the best hair transplantation? Is the transplantation that you can never understand, including us. So it will give a natural appearance for every patient. We try to do as good as we can because we just do really dense incisions for the patients, but the incision, of course, the direction is also important. We just maintain the same thing what the patient had, so we give the same direction of the hairs according to that. So patient will, after all grows with the existing hairs, it will give a really natural, good looking for every patient.
Hello guys, I'm Dr. Gökay Bilgin from Smile Hair Clinic. Today I want to talk about needleless anesthesia and why do people present it like painless anesthesia. You know, hair transplantation market is huge. So actually people want to lure the patients in their clinics. So they present needleless anesthesia like it's painless. Of course we have needleless anesthesia, but I want you to inform that you will have a little bit pain depending on your pain threshold. Actually, none kind of the anesthesia, any technique is 100% painless. I want you to inform that. Thank you.
Sometimes patients can see hair loss, or they can call them even baldness, in the donor zone. It's called actually shock loss. It's because the lack of circulation of the donor zone. What can be done is actually you can apply minoxidil spray twice a day or in form of the minoxidil and massage whenever you remember to increase the circulation of the scalp at donor zone. After a couple of months, generally 4 months later, the baldness will be full of hair again. There's nothing to worry about this if it's not over harvesting.
Okay, so what should patients use after the operation? Especially we give them a bag which contains an antibiotic, a painkiller, some steroid, anti-inflammatory tablets, but they just use them for 5-6 days. But for a long time, what should patients use? So all over the world there are only 2 approved products, which is finasteride and minoxidil. In some cases, if the patient really needs for long-term usage, like miniaturization of the hairs or thinning, actually for the existing hairs, we recommend them to use, we have to see the progress, we have to see the results. They can also use minoxidil after the operation if it's necessary. We recommend it to some patients also. It's a topical form and they use twice a day, but they should start it after 14th day of the operation. What should patients expect after the hair transplantation? Actually, it's a long progress, which takes a while. It's not an instant result like the other surgeries, but at the first 15 days, it really grows well, and patients like this period so much because they have been waiting for a long time, and after that, it really grows in a good way. But after the second week, we expect a shock loss period until 3rd or 4th month. And till that time, it's not an easy period for the patients. Become sometimes disappointed because of that period and they are thinking if it's successful or not. But then we expect growing after that period and it really grows until 2nd year. But whatever we see in the 1st year will be 70 or 80% of the result that we're gonna see in the end. Okay, so all the patients are asking us how long does it take for the whole recovery. At least it changes from patient to patient, but as generally, in order to give some numbers, 5 days for donor area and up to 3 weeks for the recipient area. But after the operation, we see some crusts and scab formation on the recipient area, which patients do not like, but it remains until 10th day if they don't clean and wash their head. But after the 11th day, we want patients to remove those crusts by a proper wash. Then it really looks fine with the recipient area. In some cases, it takes up to 3 weeks until the redness gone, but it's very rare with most of the patients.
We always advise our patients to have PRP and mesotherapy sessions combined after hair transplantation. They can start PRP injections or mesotherapy injections 1 month after hair transplantation. Every doctor has different kind of protocols for this treatment, but at least 8 months will be boost to hair growth and the quality of the hair transplantation. So, one of the biggest questions of our patients is that when can I go back to sleep normal? Your grafts will be attached to your skin after 5 days. But we love to be in the safe space, so we always tell our patients to sleep carefully as we told them how to for 7 days. After 7 days, they can go back to sleep normal again.
So, when you're doing your research on web, you may have seen some headlines like organic fue, ice fue, sapphire fue, diamond fue, maybe even tomato juice fue. So I want to tell you that they are all lies. Actually, there is only one technique, follicular unit extraction, and other techniques to implant the grafts. So, as you know, hair transplant is a very big market and it's very dirty. So please don't believe in the clinics which tell you, which advertise like they are doing something different more than the other ones. Actually, we are all doing the same job. Some of us are honest and doing their best to give you the best result. Thank you.
Hi everyone, I'm Dr. Mehmet Erdogan from Smile Hair Clinic. We are one of the top clinic in Turkey with operating in a full equipped and accredited hospital. And also Smile Hair Clinic is one of the largest clinic in Europe and Turkey with the total surface area. In Smile Hair Clinic we are total 3 doctors operating mostly hair transplantation, beard and DHI. We are providing service to our international patients as a whole travel package.